Understanding Auditory Processing Disorder. Introduction. Auditory Processing Disorder APD, also known as Central Auditory Processing Disorder CAPD, is a hearing problem affecting approximately 3% to 5% of school-aged children. While these children can hear sounds, they struggle to understand and interpret them due to a lack of coordination between their ears and brain. Recognizing the problem, children with APD typically face challenges in distinguishing subtle differences in sounds, particularly in noisy environments such as classrooms or social gatherings. Despite hearing sounds in quiet settings, they may struggle with speech comprehension and direction following in louder or more chaotic situations. Signs and symptoms. Identifying APD can be complex due to its varied symptoms, which can range from mild to severe. Parents should observe for signs such as mishearing sounds and words frequently, difficulty in noisy environments, improved performance in quieter settings, trouble following verbal directions, struggles with spelling, phonics, or verbal math problems, difficulty in following conversations. Distinguishing APD from other conditions. APD shares symptoms with various other disorders like speech-language delays, learning disabilities, ADHD, and depression. Additionally, auditory memory deficits, attention problems, and sound sensitivity can coexist but aren't exclusive to APD. Consulting audiologists and related specialists can help in accurate diagnosis and understanding of these conditions. Managing APD. Early diagnosis is crucial for effective management of APD. While there's no cure, strategies can be employed to help children cope and succeed in academic and social settings. These may include environmental modifications to reduce noise distractions, utilizing assistive listening devices, implementing specialized educational programs, speech-language therapy to improve communication skills, encouraging self-advocacy and understanding among peers and educators. Causes of APD. The exact cause of APD in children often remains elusive. However, certain factors like head trauma, lead poisoning, seizure disorders, or chronic ear infections may increase the risk. In some cases, there may be a combination of factors contributing to the disorder. Diagnosing APD. Diagnosing APD requires a comprehensive evaluation by an audiologist, a specialist in hearing disorders. The diagnosis typically involves a series of specific listening tests aimed at identifying key problem areas, including auditory figure ground, difficulty understanding speech amidst background noise or babble, which can be particularly challenging in noisy environments like classrooms, auditory closure, inability to fill in missing pieces of speech, especially when the speaker's voice is fast or unclear, dichotic listening, trouble understanding competing speech from different sources simultaneously, temporal processing, challenges in processing timing cues crucial for distinguishing speech sounds, understanding pitch variations, humor, and making inferences, binaural interaction, difficulty in localizing sound sources in space, which may be more prevalent in children with a history of brain trauma or seizure disorders, early diagnosis and intervention. While traditional APD tests are typically administered to children aged 7 or older, newer electrophysiology tests offer early insights into the central auditory system in younger children. Early diagnosis is vital for timely intervention and support. Strategies for managing APD. While there's no cure for APD, various strategies can assist in managing the condition and enhancing auditory skills as the child's auditory system matures. Environmental modifications. Creating conducive listening environments by reducing background noise and distractions. Individual therapies. Tailored interventions such as speech-language therapy, counseling for associated emotional issues like depression or anxiety, art therapy, music therapy, or occupational therapy to address sensory concerns. Assistive listening devices. Utilizing devices like remote microphone systems, formerly known as FM systems, to amplify the speaker's voice over background noise. Speech optimization. Encouraging clear and deliberate speech, minimizing distractions, and ensuring optimal seating arrangements, especially in educational settings. Computer-assisted programs. Engaging in specialized computer-assisted programs designed to improve auditory processing skills, which may be available through schools or recommended by audiologists. Parental and educator support. Collaborative efforts between parents, educators, and healthcare professionals are crucial in implementing effective strategies to support children with APD. Creating a supportive environment both at home and in educational settings can significantly alleviate the challenges associated with APD and facilitate the child's overall development and well-being. At home, reduce background noise. Create a quiet environment whenever possible to minimize distractions during conversations or activities. Encourage visual cues. Have your child look at you when speaking to provide visual clues that aid in understanding and filling in missing speech information. Utilize chunking. Break down instructions into smaller, simpler parts with fewer words and key phrases to enhance comprehension. Speak clearly and slowly. Communicate in a clear, deliberate manner at a slightly slower pace, emphasizing clarity over volume. Seek confirmation. Ask your child to repeat instructions or information back to ensure understanding and retention. Use visual aids and routines. Use visual tools such as core charts, calendars, or lists to reinforce verbal instructions and establish routines that provide structure and predictability. Explore assistive technologies. Consider using closed captions on TV and computer programs to aid in auditory comprehension. Encourage self-advocacy. Empower your child to communicate their difficulties with listening and advocate for themselves, whether through verbal communication or agreed-upon visual signals. Promote patience and understanding. Remind your child that learning differences are natural and progress takes time. Offer unwavering support, patience, and reassurance throughout their journey. At school, educate school staff. Share information about APD with teachers and school staff to foster understanding and support for your child's needs. Consider accommodation plans. Depending on the severity of your child's difficulties, they may qualify for an individualized education program (IEP) or a 504 plan outlining specific accommodations in the classroom. Optimize classroom environment. Arrange for strategic seating closest to the main speaker to reduce distractions and enhance access to speech. Provide pre-teaching and visual aids. Introduce new or unfamiliar vocabulary beforehand and utilize visual aids to supplement auditory information. Utilize recorded lessons and technology. Offer recorded lessons for later review and explore computer-assisted programs designed to support children with APD. Maintain open communication. Stay in regular contact with the school team to monitor your child's progress and address any emerging needs or concerns. Promoting success and well-being. Acknowledge real challenges. Recognize that APD symptoms are real and beyond your child's control. Validate their experiences and focus on finding effective strategies for support. Foster positive attitude and self-esteem. Cultivate a positive, realistic outlook and instill confidence in your child's abilities. Emphasize that with patience, love, and support, they can overcome challenges and achieve their goals. By implementing these strategies both at home and school, and fostering a supportive environment filled with patience and understanding, can thrive and reach their full potential alongside their peers.